when we're seeing kids, we're always assessing their severity of symptoms and are the interventions that we are doing working. And so we have to think about, if hopefully they are in therapy and getting exposure response prevention for their OCD symptoms, and perhaps they're getting medication. But when we see kids starting to struggle more, so I think about that in their different environments where they spend most of their time. So school, home, and maybe activities like sports or music or whatever their interest might be. If they start spending more time by themselves, isolating at home, or if they're not performing in the same way at school, if they're isolating from friends, perhaps like at school, they are still maintaining their grades, but if they have a kind of OCD where they're perfectionistic and it's taking them now hours to do their homework, and so they really can't do anything else in the evening, those are times whenever you start to think about higher levels of care. So because they're not able to do typical developmentally appropriate things that they have been able to do historically. So if it's impacting school in a serious way, or if it's impacting the family, there's something called family accommodation that's really important for kids with OCD. And so parents and siblings and friends do this because they think they're helping. So they do things that I always call it aids and abets their OCD. So again, we often use contamination as an easy example, but parents will go and maybe turn on the handles at a sink because they don't want to touch them because they're dirty. So they'll turn it on so the child doesn't have to touch it because maybe they think that's contaminated. Those are all doing things to accommodate OCD. And so that's another big measure that we use to say how much accommodation are parents, siblings, friends having to make for a child to function. And if everyone's having to accommodate all of the time, that's also another sign that they may need a higher level of care. So family accommodation, ability to function at home or school, and then perhaps medication failures too can be another way to look at. They may need a higher level of care if they've been through several medications, they're still struggling, they've had good exposure response prevention treatment in the outpatient arena, and it's not getting better. It's pretty hard for families to do a lot more than like weekly family therapy unless they're in a more structured program that's a higher level of care where they can, go and spend, several hours per day. But just going to do like 1 hour kind of here and there during the week in outpatient therapy and doing the homework can be tricky for families. So sometimes that higher level of care can be really helpful to kind of bring it all together and get some family accommodation more under control too.